Hello, my name is Martha Koda, and for my Sports Medicine 3 Unit 5 nutritional project, I'll be focusing on foods for athletes who have elevated or low potassium levels. It is important to regulate potassium because it's an electrolyte that helps control blood pressure, protect against strokes, and cardiovascular diseases. The process starts with ingestion, where the electrolyte travels down to the GI tract to be absorbed into the bloodstream. 90% go into the cells, with 98% going into the intracellular fluid and into the extracellular fluid, and then the other 10% is excreted through feces and sweat. There are two different manners the body regulates the amount of potassium. We discussed earlier the external potassium balance through potassium intake and excretion, and then we discussed minorly the internal potassium balance with potassium distribution in the extracellular fluid and the intracellular fluid. So when we're talking about the distribution, we always want to keep 98% in the intracellular fluid since that's where potassium is housed, and then the other 2% in the extracellular, because the potassium in the extracellular fluid is the concentration in the bloodstream. So if there's more than 2% outside of the cell, that means that there's going to be an elevated potassium concentration in the bloodstream, and vice versa if there is less than 2%. Okay, going back to the external potassium balance, when you have less excretion than intake, that means that you have a positive potassium balance, which can cause hyperkalemia, which is high potassium in the blood when left for a long period of time. And then when there is more excretion than intake, this causes a negative potassium balance, which is called hypokalemia, which is low potassium in the blood. The ideal rate of serum concentration is 3.6 to 5.0 milliliters, and then hyperkalemia would be anything over 5.0 milliliters, and then hypokalemia would be anything less than 3.6 milliliters. There are multiple illnesses that affect the regulation of potassium in the bloodstream. These are all hyperkalemia related illnesses. So, first we have diabetes, and diabetes elevates potassium in the bloodstream because when there is excessive glucose molecules outside of the cell, they prompt potassium molecules to move out of the cell into the extracellular fluid, and this increases the amount in the percentage in the extracellular fluid, thus making the concentration of potassium in the bloodstream even larger. And then high blood pressure, hypertension can be brought back to normal levels with potassium because it's its natural solvent. So this can increase potassium, and we should especially watch out when someone has diabetes and high blood pressure, because we really want to limit the amount of potassium they're ingesting because of the diabetes and the high blood pressure all contributing to the amount of potassium in their bloodstream. And then we have rhabdomyolysis, which is associated with hyperkalemia, which is renal failure causing elevated potassium levels, decreased potassium and phosphate due to excretion through urine. And now these are the illnesses that are related to hypokalemia. So there's Bartter syndrome, and it's where the body removes too much sodium, which causes a rising amount of a hormone, aldosterone, to be produced. And then the kidneys remove too much potassium, which is called potassium wasting. And then we have Gittleman syndrome, which is the increased secretion of potassium and hydrogen ions, causing hypokalemia and metabolic allosis, which is elevated pH levels. And these are two rare genetic kidney disorders that cause imbalances. And going to hypomagnesemia, which is caused by low magnesium. Magnesium affects the balance of other electrolytes like sodium and potassium, and specifically for this illness, it causes increased urinary excretion and the depletion of potassium in the intracellular fluid of the cell, which would be that the potassium moving out of the cell into the extracellular fluid, which would then increase the amount of potassium concentration in the bloodstream. Okay, and now the average potassium intake varies depending on age and sex. For example, we can observe how men consume more potassium in comparison to women, and this can be all due to caloric intake. On average, men tend to eat more than women, so that's most likely why their potassium intake is a little bit more than women. And then additionally, women who are pregnant or breastfeeding consume slightly more of the electrolyte compared to the average female. These are some food with high potassium levels for athletes who have hypokalemia and want to increase the amount of potassium in their bloodstream through nutrition. And some examples is dried fruit, lentils, squash, prunes, raisins, potato, orange juice, bananas, and milk. And then these are some low potassium food with people with hyperkalemia who want to limit the amount of potassium they're ingesting. And some of these foods include pasta, apples, rice, asparagus, berries, bread, which is non-grain, white mushrooms, carrots, and coffee. And now continuation. High potassium, which is basically hyperkalemia, is caused by a high potassium diet. Potassium supplements that are unnecessary medication blocking kidneys' ability to secrete potassium out of the body, and this is usually seen with high blood pressure medication. And then diabetes, how I had discussed earlier, with the glucose surrounding the cell, making the concentration more. And then the treatment would be diuretics, which is a water pill, and it causes urination. And this would decrease the amount of potassium in the bloodstream. And then there's medication management, which is seen a lot with high blood pressure. Since high blood pressure, it's potassium is a natural solvent for high blood pressure. We really want to limit the amount. Um, we also have potassium binders, which is basically where more potassium binds to feces to be able to excrete more from the body than normal. And then there's also IV therapy, which is seen a lot with diabetes, which is mainly the use of insulin, and this decreases the amount of glucose surrounding the cell. And this makes sure that potassium isn't prompted out of leaving the intracellular fluid into the extracellular fluid in order to keep that homeostasis. And then also, most of hyperkalemia is seen within people who have chronic kidney disease, and they'd usually go into dialysis when they have increased potassium in their bloodstream. And then for decreased potassium, which is hypokalemia, that causes diuretics. So usually this is seen when someone has high potassium levels and they're trying to decrease. And whenever they take diuretics, then that makes their potassium levels decrease more than what they hoped. And this is also seen with the insulin, how I had mentioned in the IV therapy. And this is basically caused from trying to reduce high potassium, and then it causes low potassium. And then there's excessive sweating. So usually we account for 1 to 2% of our potassium being excreted through sweat. So when it's more, then this causes a decrease in the amount of potassium in the bloodstream, just because that sweat comes from the bloodstream. And then there's low magnesium, which we discussed earlier with one of the hypokalemia illnesses, because magnesium impacts other electrolytes like potassium and sodium. And then the treatment for this is the potassium supplement, and usually this is done first, and if the supplement doesn't work out, then potassium is done intravenously by a physician. And then this is my works cited, which contains all the websites I visited and got my information from. And thank you for listening to my presentation.